What's going on, everyone? This is Vince with VShred.com, back with part 4 of our 6-part physical therapy Fix Your Body series. And we're here with Dr. Zaki Afzal. And today we are going to be talking all about hip pain. So if you're dealing with pain in your hips, whether that be just throughout the day or while you're squatting or whatever it might be, today, this is the video for you.
I'ma keep on going up till the lights go down.
All right, so like I said, in today's video, we're gonna be talking about the hips. And so if this is your first time seeing this video, or this is your first time seeing one of these videos in this series, make sure that you're going and checking out our videos about the neck, about the shoulders, about the low back, and depending on when you're seeing this, we even have videos coming out about knees and ankles as well. So if you have issues with any of those areas, go check out those videos. But we also, if you haven't seen these videos, this is Dr. Zaki Afzal. This is my physical therapist. He's got his doctorate in physical therapy, helps a bunch of professional athletes here in Las Vegas and just from around the world. And so thank you for being here with us.
Yeah, absolutely. Thank you for having me. Thank you to the VShred community for having me. Like you said, I'm Dr. Zaki Afzal. I'm a performance physical therapist working specially with active adults and athletes, people that are in the gym, on the field, on the basketball court, and that want to look and feel the way they want and not let their body kind of limit them. So this is why we are doing this series, to help everyone watching these videos feel much better.
Yep, and so like we said, today we're talking about hips. And so a lot of people have issues with hips. I myself have personally had issues with hips. And so Zaki's going to be taking us through a couple of different ways to assess what your hip pain is coming from and ways to hopefully help you ease some of that pain with a couple of exercises that you can do from home by yourself. So take it away.
Thank you. So for this video, we're going to talk about hip pain that occurs mostly in the front of the hips. Generally, if you're active, if you're in the gym, you're working out, you're doing things, you usually have pain more so here rather than in the back or on the side of the hips. Generally, an older population that maybe spends a lot of time sitting and not too active has more pain on the side of the hips. So we're going to talk about more on the front of the hip because there's a lot to unpack here. So the first thing we're going to talk about is assessing yourself. How do you see what motions you are limited in? So while we're here, we're going to check hip rotation first, okay? So this is really easy to do at home. You may want a mirror in front of you or even turn your camera into selfie mode, put it in front of you so you can see how you're moving. And so all you're going to need is to take a seat. So I'm going to have Vince take a seat here.
Feet off the ground?
Off the ground, yep. Slide back. And what we want to see is how much internal and external rotation you have. So if we think back about the shoulder motion video, then we're still going to be talking about those same motions. Now it's about the hips instead, right? So internal and external rotation happens at the hips when your knee is stable and not moving and your foot is moving instead. So external rotation is going to be when his foot, this is a little counterintuitive, but when his foot moves inwards, that's external rotation of the hip because the hip is turning outwards. Okay? Internal rotation is in this way, foot moves out, but the hip moves inwards. Okay, so you want to check that out on yourself. So you can even just actively do those motions yourself, either pulling your leg up the way Vince is, or even doing it after he does it with his hands, doing it just by yourself, using the foot going in and out that way. And you should see a little bit of difference whether you're using your hand versus doing it yourself. If you're using external resistance with your hand, then generally you'll have more motion that way. And you want to check side to side, especially if you have one hip that hurts and the other hip that doesn't have too much of an issue. You want to see, does one look different than the other? Because then apparently we want to be able to move the hip that isn't moving well towards looking more like the one that is moving well. Okay, so that's internal and external rotation. Normal values you want for this is we want external rotation. If this is 0 degrees, we want it to about 45 going out this way. So Vince's is pretty good out here. And internal rotation, we want a little bit less is okay. We want it to get at least about 35. Here, he may be a little limited here. So something we'll kind of take progress pictures of and we'll keep track of throughout this video to see can we improve that, okay, on his right hip. Okay, so the next thing you're gonna assess is hip flexion. So Vince is actually gonna lie down on his back on the table. And hip flexion is just a fancy term for how far towards your chest can you bring your knee. Now, this motion is going to be apparent during a lot of things during your life, right? Whether you're getting out of a chair, getting out of your car, off a couch, off the toilet, squatting, lunging, leg press, all this motion is going to come up a lot. So you want to make sure you have pretty decent range of motion here. So what Vince is going to do is he's going to pick up his knee and let it bend and then bring it up towards his chest. We're trying to see how close can he make this angle between his torso and his thigh. We want this generally to be about 110 degrees or higher. Some folks are flexible enough to where this this only stops because it's hitting their torso.
Not me though.
Not Vince though. So he has a little bit of a limitation there. And another thing you're gonna notice is if you have a little limitation, you're gonna notice that your hip kind of wants to go outwards this way. And that way you have more motion, right? So that tells us a little bit about how your pelvis is moving and how it has a little bit of a bias of wanting to turn your foot out this way. Because we always say the pelvis is the train tracks, the hip is the train. The train's only gonna go where the train tracks allow it to. So if the pelvis isn't moving the way you want, then a lot of times the hip's not gonna move the way you want. So on Vince's right hip, we do see he has a little limitation in flexion and little limitation in internal rotation. I'll be honest, that's pretty common and typical in the lifting population. So let's talk about how to improve that. Okay, so the first spot we want to take a look at is we want to take a look at a part of the glute that can really limit those motions. And if he flips over to his side facing me this way, people do foam roll the glutes all the time. They'll put a foam roll to sit on it and they'll kind of work on the kind of big meaty part of the glute through here. But an area of the glute that tends to go unrecognized as limiting motion is going to be an area of the lower glute. So that hip bone that all of us have on the side here, that sometimes we bump into the wall, we feel it, you want to make sure the glute you're targeting is actually the level below that bone. Okay, so still going to do what we call the gluteus maximus, the big glute through here, but we want to make sure the soft tissue is kind of occurring in this area, and Vince doesn't like that, like pretty immediately doesn't like that because it's an area that may need a little bit of attention. Okay, so the way we're going to have Vince work on this is we're going to have him take a lacrosse ball at home. It could be a tennis ball, it could be your dog's chew toy, something that's firm that can get into this area a little bit. So he's going to flip over onto his back and he's going to put it directly on that spot that he feels at. Now, he can either lay down on his back this way, he can either sit up with his upper body this way, depending on how much weight he wants to get onto it. So this is usually an easier way to kind of find that spot. And his face is going to change once he finds that spot, right? That's what we're looking for. It should be almost like a hurt so good type feeling where you know that's the face right there, that you know you've hit that spot. Now, when you're on that spot, you're going to kind of move it around. It's not going to feel the greatest, but what we're looking for is the result afterwards, okay? So when we're doing it, luckily for him, we don't have to spend too long. 30 seconds to 60 seconds is really all we need to give us the opportunity.
It's gonna feel kind of long.
Right. It gives us the opportunity to get enough stimulus in that area to open up that muscle to allow us to move a little better. And that's all we're looking for here. Any soft tissue stuff you're doing to your body, whether it's with a foam roller or lacrosse ball, isn't gonna give you permanent changes, but it can allow you to move a little bit better to get those permanent changes with other movements like squatting and lunging now in better form. Okay, so after about 30 seconds here, we're gonna pop that ball out. Ooh. And Vince is gonna lie back down on his back. And then he's gonna recheck that same motion he did, which was hip flexion, where he brought his knee up towards his chest, right? So when he brings his knee up towards his chest, clearly closer towards his torso, and that was in 30 seconds. He didn't have to spend any time stretching, didn't have to spend any time mobilizing that area. Just one part of the glute that a lot of people that lift have issues with and can tend to get sticky a little bit and limit that motion. So now that he has that motion, he has more motion to squat, deadlift, lunge, or do anything that requires his knee to go up towards his chest.
So people will find that helps minimize their hip pain from this.
Yes. So what that happens is now that backside's kind of unlocked, now since he has more room in the front, he won't run out of room and feel that pinching type feeling in the front as they bring the knee up towards their chest. Because that's generally what people will report is they have that pinching type feeling in the front once their knee gets closer towards their chest.
Cool. So what's the next one?
So now that we have opened up that backside, now we need to show him a way to get his pelvis moving. Remember we talked about the pelvis being super important for the way hips move? Let's talk about getting that pelvis moving in a couple positions that can really open up that hip and get him moving better here. So for this exercise, he's actually gonna stand up. It's a little bit more of an active exercise. And what we're gonna need is something that's about anywhere from between 4 to 6 inches, something stable that you can put your foot up on, okay? So what he's gonna do is he's gonna assume kind of like a split stance, almost like in a lunge or split squat type position. He's gonna throw his right foot from the platform here and back foot a little bit further back. Now, this is kind of a similar position to a normal split squat lunge position that people get into. What we wanna see is I wanna see how much can he move his pelvis while his foot is on this platform, okay? Because if he was to just do a normal split squat for me, down and up, not too tough. He has this motion, he's not worried about this. But if we look at the direction his pelvis is kind of moving here, it's kind of open back in this direction. We want to see, does he have the opportunity and the ability to actually bring the pelvis close down into this direction? And what that does is that you should automatically feel a little bit of stretch in the butt and this groin muscle kind of turn on. Super important muscles to be able to get your hip into a compressed position, a stable position to be able to lift some weight.
Literally just doing that, by the way, just turning my hips, I immediately feel that.
Yeah.
And the longer I hold it, the more I feel it.
Absolutely. And if you don't feel it, we have to stay in this position until you do. A couple extra tips to feel that a little better is you can shift your weight a little bit forward onto this front foot. We want about 75% here, 25% back here. And I want you to be able to make sure you're feeling the inside edge of your foot and you're not rolling to the outside part of your foot. A lot of folks that have hip issues tend to have a bias towards going towards their outside part of their foot. So make sure you feel it on the inside. And you should feel that pretty quickly. Now, all we got to do here for the beginner is go in, come on back out, go back in, go in as far as you can. Feel those muscles turning on that we talked about. Come on back out. Now, for someone like Vince that I've worked with, I know his level's a little bit higher. So we're going to actually go to the next step of this exercise, which is in this position, performing that split squat. Now, what we want to feel here is those muscles that we talked about, and it's going to feel harder than that normal split squat he started with, right? So what this does is it allows that back of the hip to kind of open up, allows your adductor or groin muscle to be a little bit more involved, and it takes a little bit of stress off that front of that hip. Okay. So usually with this, we only need to do about 5 or 6 reps, and we should get the improvement we're kind of looking for, especially an internal rotation of the hip and hip flexion where your knee comes up towards your chest. Now with this, making sure that the inside edge of the foot is still down, and he comes up and down, and think elevator, not escalator. See how Vince's body's moving down and up and not at an angle and down?
Not going like this.
Exactly. We're thinking elevator, not escalator for this, okay? So we'll do one more rep here. And then let's recheck his internal rotation. So he's gonna sit on his butt here one more time. And it's quite a burner, right? It's labeled a rehab or like a mobility exercise, but it can build muscle, it can build strength at the same time, depending on how you do it. So now that he sat down, we're gonna get him in that same position, and we're gonna see how far out can he move this shin. And now he has full range of motion in his internal rotation. Not only did he just build strength and build some muscle there possibly, but he's also improved his range of motion, which generally most exercises don't hit all 3.
And generally, when you increase your range of motion, you are minimizing pain.
Yes, absolutely. So now he has more motion there. Now if he lies on his back one more time, we can check out what his hip flexion looks like one more time, just for curiosity's sake. Go ahead and bring that knee up towards your chest. And beautiful. I know worth working with him. This is what he normally should have and has the capability to have. And this is where we want him hanging out for the most part. And now that makes it so he has less pinching in the front of the hip, but also it makes it so during a squat, you're not getting your back involved as soon and your hips are doing more of the work, which is what you want.
Cool. So again, that's, and how many sets and reps of that? So you said 5 reps.
Yeah, 5 to 6 reps, 2 sets is usually enough to get the changes
Every
you
day?
want. Yeah, that's a great warm-up to add into a leg day, great warm-up to add before a run, or just something you want to start your day off with. Really easy to do.
Cool. And so what's next?
So next, we're going to transition over how do we make this change in the gym? We're talking about these things that you can kind of do at home, do on the table. How do we make this transfer over to not having that front of the hip pinching during squatting, which is a huge complaint I see with a lot of people with hip pain. So it's similar to what we talked about in our low back pain video. It's the starting.
Check that out. Go watch it.
Yeah, please watch that. So it's similar to what we talked about because the starting position is really going to tell you how much motion you have.
And by starting position, he means basically your stance, your posture as you're at the top of the, as you just have this bar on your back or holding a dumbbell here, this spot right here.
Absolutely. So starting position is going to tell us which part of the hip has room and which part doesn't. So if he goes into that, remember that overextended position we talked about in the low back pain video, if he goes in that overextended position where he's really arched back here, we've automatically shut down some room in the front of the hip. So as he's squatting down, he runs out of room in the front of the hip much sooner. And we'll show you on the table how that kind of works. Runs out of room a lot sooner. But if he starts in that more stacked position here, kind of pelvis tucked under, now he gives the front of his hip a little bit more room so he can go deeper without feeling that pinch and without asking the back to come online, right? So if he lies on his back one more time, we're going to show you that example, and you can do this on your own at home as well. If he goes into that arch position, that overextended position that we sometimes see, and then he tries to bring his knee up towards his chest, we'll see how far can he go before it stops. So it stops pretty soon, right? Now keep the knee there, bring this down to that stacked position, and it unlocks motion that he has. So if you feel that tightness, a lot of times you have that motion already. You don't need to open that up. You just need to alter your starting position and you can feel better pretty immediately.
That's crazy.
Yeah, it's pretty quick, and it's a really good way to actually show like why that motion is limited during your squat or why you might feel that pinching in the hip.
And so for anybody out there dealing with hip pain, try this out. The 3 exercises again were?
So we talked about the lacrosse ball to that lower part of the glute. We talked about the front foot elevated split squat. It's a mouthful, I know, but really helpful exercise. And then just assessing your starting position before that squat, making sure you're in that stacked position here and not overextending to run out of room in the front of the hip.
Cool, so try those out. Let us know what you think. Again, if you haven't checked out the video on low back pain or neck pain or shoulder pain, go check those out. And depending on when you're watching this video, we're also coming out with a video next Sunday on knee pain, which is a huge one and possibly going to be my favorite of this series just because I have the knees of a 70-year-old. So make sure you're coming back for that. If you enjoyed this video, make sure that you're smashing that thumbs up button below, commenting down what your thoughts are below this video, and subscribing to the channel and turning on post notifications. That way you don't miss out on our next video where we're talking about knee pain. But that's all for today, guys. Zaki, thank you for being here, man.
Absolutely.
And we'll see you in the next one.